An estimated 15 million babies are born preterm every year. Taking care of these babies is costly as well as risky. Approximately 1 million children die each year due to complications of prematurity. Although there are many prematurity-related issues causing severe complications and death, we do focus on feeding.
Oral feeding skills or the feeding maturity is important for optimal growth and neurodevelopment in preterm infants. This is also one of the gold standards for hospital discharge readiness. Successful and safe oral feeding or feeding maturity is coordination of sucking, swallowing, and respiration. Preterm infants often have problems with this process. Therefore, lack of feeding maturity causes serious complications like aspiration of food into the lung, aspiration-related respiratory disorders, hypoxia, and neurological deficits.
Safe and successful oral feeding implies a minimum risk of aspiration. NeoSAFE focuses on respiration swallowing patterns to detect safe feeding. Disorganized swallowing respiration patterns causes silent aspirations. Without a proper fluoroscopy, we cannot diagnose silent aspirations. It is not possible to provide a video fluoroscopy for each infant each time, but NeoSAFE can detect the risk.
A new technology, a non-invasive medical device for the assessment of feeding maturity, has been developed.
Swallowing frequency and related parameters, as we documented before, differs the immature and mature swallowing processes. This is the feeding maturation that we are able to detect with NeoSAFE. Two probes with non-invasive sensors are attached under the chin and on chest of the baby. Then the baby starts feeding and the device monitors this in just about 2.5 minutes. Then an assessment report is generated for healthcare professionals.
This device, NeoSAFE, will not only provide better healthcare services, but also helps hospitals to prevent workload and cost arising from readmissions. Not only it will help to prevent complications, but it also will shorten the discharge time. We will have a great degree of confidence while deciding to feed a baby orally and discharging the baby from the hospital.
Until now, we have no tool that would help us decide feeding maturity objectively. With NeoSAFE, we would all have a tool that would help us decide infants' feeding schedule, feeding method, NICU time, and safe discharge decisions objectively, non-invasively, and without pain. In short, we will achieve objective knowledge whether the preterm is ready for oral feeding or not.
The most important positive effects of this solution are to babies and their parents. I think the parents will be more confident and feel safer while taking their babies home. They will feel more comfortable caring for their babies with the help of the feeding maturity test.